Systematic review and meta-analysis of the effectiveness of radiofrequency ablation in low-grade dysplastic Barrett's esophagus. Introduction. Barrett's esophagus, BE, is a premalignant condition characterized by the replacement of the squamous lining of the esophagus by columnar epithelium resembling intestinal metaplasia, IM. The main risk factor for developing BE is gastroesophageal reflux disease, GERD, yet many patients are asymptomatic. BE is also associated with obesity, smoking, and the presence of a hiatus hernia, and is commoner in men. Endoscopic screening in patients with 2 or more risk factors and GERD symptoms can be considered, with a lower threshold in patients with a family history of BE or esophageal carcinoma. The incidence of BE is increasing in the Western world, being reported to occur in 2% of the adult population, and this has been associated with a concomitant increase in the incidence of esophageal adenocarcinoma, EAC. IM can progress via low-grade dysplasia, LGD, and high-grade dysplasia, HGD, to EAC, which has a poor prognosis. The rate of progression to cancer in patients with LGD is reported to vary between 0.6% and 26.5% per year. Dysplastic segments must be confirmed by 2 expert pathologists because misclassification of LGD has been shown to contribute to lower progression rates in some studies. The management of BE is determined by its stage. The National Institute for Health and Care Excellence, NICE, recommends that patients with IM or LGD undergo endoscopic surveillance and repeat biopsy. If HGD or cancer is detected, endoscopic treatment or esophagectomy is recommended. Endoscopic treatments include endoscopic mucosal resection, EMR, photodynamic therapy, PDT, cryotherapy, and radiofrequency ablation, RFA. Because the risk of cancer increases with the grade of dysplasia, it is important to treat BE when the risk is at its lowest, thereby avoiding high-risk surgical treatments such as esophagectomy. RFA consists of the delivery of controlled radiofrequency energy endoscopically, and 2 randomized controlled trials, RCT, have reported it to be safe and effective, with a significant reduction in progression to esophageal cancer. Although RFA has been shown to decrease the progression of LGD to HGD or cancer compared with surveillance, it is neither widely available nor routinely used. Therefore, the aim of this review was to assess the efficacy of RFA in the treatment of LGD. Background. Barrett's esophagus, BE, is a premalignant condition characterized by replacement of the esophageal lining with metastatic columnar epithelium, and its management when complicated by low-grade dysplasia, LGD, is controversial. This systematic review and meta-analysis aim to determine the efficacy of radiofrequency ablation, RFA, in patients with LGD. Methods. Medline, Embase, and Web of Science were searched for studies including patients with BE-associated LGD receiving RFA, January 1990 to May 2017. The outcome measures were complete eradication of intestinal metaplasia, CE-IM, and dysplasia, CE-D, rates of progression to high-grade dysplasia, HGD, or cancer, and recurrence. Results. 8 studies, including 619 patients with LGD. RFA equal 404, surveillance equal 215, were analyzed. After a median follow-up of 26 months, range 12 to 44 months, the overall pooled rates of CE-IM and CE-D after RFA were 88.17%, 95% confidence interval, CI, 88.13% to 88.20%, P less than 0.001, and 96.69%, 95% CI, 96.67% to 96.71%, P less than 0.001, respectively. When compared with surveillance, RFA resulted in significantly lower rates of progression to HGD or cancer. Odds ratio, OR, 0.07, 95% CI, 0.02 to 0.22. The pooled recurrence rates of IM and dysplasia were 5.6%, 95% CI 5.57 to 5.63, P less than 0.001, and 9.66%, 95% CI 9.61 to 9.71, P less than 0.001, respectively. Conclusions. RFA safely eradicates IM and dysplasia and reduces the rates of progression from LGD to HGD or cancer in the short term.